everyone, I am Kuya May Amisidro, and today we are going to perform the application of the Moiset. So the purpose of this procedure is to reduce muscle spasm and decrease joint stiffness present on our patient. So for the assessment, first is we will assess our patient's condition. First is, good day ma'am, may I ask for your name po? So, your name is Ayana Naku po. To verify your identity, may I look at your wristlet? So, it states here po that name is Ayana Naku, female, bed number 1, birth of date June 9, 2001. Is that true po? Okay po, ma'am. So, after that, we will check the doctor's order on the patient for the need of heat application. So, the location of the heat application will be on the deltoid area of our patient due to the presence of redness and muscle spasm. So, there are no presence of open wound. So, the procedure will last for 10 to 20 minutes depending on the patient's pain tolerance or depending on the patient's condition. So, after that, we will assess the area of the procedure. So, ma'am, may you put your hands above here po. So, there are presence of muscle spasm around the area, here in the deltoid area of the patient, and there are redness that surround the muscle spasm. So, now is we will assess the area. So, I will perform palpation po. So, ma'am, do you feel any pain po? Here po. So, yes po. Here po, on the area that surrounds the spasm po. Minimal lang po. Okay po, ma'am. So, also, I've already checked my patient's blood pressure and pulse rate a while ago. So, we will also check the neurovascular skills of our patient. So, we will inspect the sensitivity of our patient to temperature and pain. So, ma'am, is this heat okay with you na po? Isa pa po, ma'am. So, tolerable naman po yung heat. So, yes po, ma'am. That's good po. And then, also, we already assess our patient's understanding to the procedure as well as we've already assessed the comfortability of our patient. So, ma'am, are you comfortable na po in your position? Okay po. So, next is for the planning. First is we will know the expected outcome. So, the expected outcome in this procedure is that the patient may feel comfort and may reduce or decrease the presence of muscle spasm and redness on the deltoid area of the patient. And then, we will gather all of the equipments that are to be used. So, we have our SITS tab. We also have our gauze pad, gloves, our bath thermometer, bath towel, and bath blanket, and then Epsom salt if present. So, after gathering all of the equipments that are to be used, we will proceed on the implementation. So, for the application of the Moiset on our patient, first is we will establish rapport. So, good day ma'am. Again, I am Nurse Yuri po, and I will be the one who will gonna perform the application of the Moiset po. To verify your identity, ma'am, can I ask po again for your name? So, yes po, ma'am. So, in this procedure po, we are going to provide heat application on your deltoid area due to the presence of muscle spasm and redness po. So, this procedure po will provide comfort to you po, and it will decrease the presence of muscle spasm and redness po. However po, in this procedure po, heat pack will be applied po. So, change of temperature may be felt po, and a little discomfort may be felt po. Just tell us po when you can't handle the pain anymore po. Is that okay with you po? So, our desired outcome po is again for you to feel comfort and to reduce the presence of redness and muscle spasm. Is that okay with you po, ma'am? Okay po, so after that, we will perform hand hygiene technique. And then, we need to put on our clean gloves. So, we will put on our clean gloves to prevent cross-contamination between the patient and the healthcare provider. So after putting on our gloves, we will provide our patient's privacy by closing the doors and the curtains so that our client will be more comfortable when we perform the procedure, and then we will drape our patient. Ma'am, ide-drape ko po kayo to provide extra privacy po. Is that okay with you po? Are you comfortable in your position po? Okay po, and then I will put a water proof pad here po in the area. And then, do you feel comfortable naman po, ma'am? Okay po. So, we will start the procedure na po, ma'am. So, I've already prepared the heat solution with the desired temperature, and I have already prepared the heat pack of the patient. And then, after that, we will now start preparing the gauze or the solution. So, we will pour the solution onto this container, and then we need to make sure to put on the gauze or to soak the gauze with the solution. Make sure that the solution is absorbed on the gauze pad. And then we will assess the area to be treated. So, the deltoid area of the patient will be treated. So, ma'am, I will start putting on the gauze pad na po. One layer of gauze pad will be placed on the area where the muscle spasm is present po. Is it, the temperature po ba is tolerable? Kaya naman po. Okay po. And then, we will lift to see if there are any redness on the area. So, wala, or irritations on the area. So, wala naman po, ma'am. So, I will snugly fit the gauze pad na po, and then I will cover it or secure it with a towel po. And then, we will put on the heat pack above the towel. So, since the patient doesn't have any open wound, we didn't change the dressing, as well as we didn't change our clean gloves because the area to be treated is a muscle spasm. So, we just put a gauze pad, a towel, and a heat pack. So, after that, you can also change the gauze pad under, change the towel, and then repeat the procedure. Make sure to regularly assess the patient. So, ma'am, I will regularly assess you po to check if there are any presence of burnings, irritation on the skin po. So, we will inspect it po. So, wala naman po. So, we can continue the procedure na po. Just tell me po if you can't handle the pain. So, while the procedure is still ongoing, you need to make sure to perform aftercare on all of the equipments that are to be used, and make sure to regularly assess your patient to see if there are any presence of irritation or burning on the area that is treated. So, now we will proceed on the application of the sits bath to the patient. So, assume that we have already performed the application of the moist heat. We will proceed on the application of the sits bath to the patient. So, our patient undergoes a surgery. So, we will first remove the wound dressing of our patient. So, we've already performed a hand washing and a proper gloving technique prior to the procedure. So, we will remove the wound dressing present on the area to be treated, and then we need to make sure to dispose it properly. And then, we can remove our gloves, perform hand hygiene, and proceed on the other procedure. So, assume that we have already did that. We will prepare the solution and the tub that will be used. So, this tub acquires a water or solution with appropriate temperature for the patient. So, ma'am, we will start the procedure in a while po. So, we will first assess the area po to be treated. So, here po in the perineum po. So, there are no presence of discharge. However, the suture lines are still intact, and there are still presence of pamamaga po. So, ma'am, I will help you po in the bathroom so that we can proceed on the procedure na po. So, assume that the patient is already on the bathroom. Assist the patient to sit above the sits tub. So, ma'am, I will help you po. So, sit here po, ma'am. And then, we will drape you po to provide privacy po, ma'am. So, assume that the patient is already on the sit tub. We will drape the patient if the patient wants to. So, the procedure will last depending on the doctor's order of the patient or depending on the need of the patient on the procedure. So, ma'am, hindi naman po ba kayo nahihilo? So, kamusta po? Hindi naman po kayo nahihirapan? Wala naman pong masakit? Okay po. So, make sure to regularly assess your patient if the patient feels any discomfort. So, after performing the procedure, we will perform aftercare to the patient. So, assume that the time is already done. We will now help our patient into a comfortable position. We will remove the tab and dispose it properly, and then we will help the patient into a position of comfort. So, after helping our patient into a position of comfort, make sure to evaluate the procedure. So, we will evaluate our patient's condition. We will evaluate the procedure itself. It's if the outcome is met. And then we will assess the area that is treated, and then we will assess and regularly assess our patient condition if there are no alterations on our patient's health. And then for the documentation, proper documentation will be performed. So we need to document all of the findings, the post, and the pre-activities that are performed throughout the procedure. We will document the procedure, the time, the route, and the duration of the procedure itself. And then we will make sure to document and to report findings that are deviated from normal to the appropriate personnel. So that ends the application of the moist-hit on our patient. So now we will proceed on the application of cold therapy the patient. The purpose of this is to stop the bleeding on the wound area of the patient, as well as to reduce the swelling on the tissue of the patient when fractures and sprains are involved. So this procedure also needs to undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, we will assess our patient. So, good day, ma'am. May I ask for your name? Yes po, ma'am. Ayana Naku. May I also look at your wristlet? So, it states here po that your name is Ayana Naku, sex, female, date of birth, June 9, 2001. Is that true po, ma'am? Okay po. So, we will check our patient's record for the doctor order. So, the patient is needing a cold therapy. So, the duration po of your therapy will depend po on your level of comfort and on your pain tolerance po. But approximately po, 10 to 20 minutes is advisable. And then po, the area to be performed is your arm, is your left arm po due to the presence of sprain po. And then, after that, we need to make sure to provide to our patient the appropriate temperature required on the order. And then, we will perform hand hygiene before inspecting the area to be treated. So, after that, we will now, ma'am, uumpisahan ko na po yung pag-assess po sa area kung saan ipaperform po natin yung cold therapy. Okay lang po ba? So, dahil nga po may presence of sprain po dito po sa arm area nyo po, most specifically above your elbow po, we will inspect it po. We will inspect po, ma'am, kung meron po bang bruises or wounds. So, wala naman po siyang wound, pero medyo mapapansin po na hindi po okay yung area na to. Dahil may mga redness po na nakakalat sa gilid. So, kailan po nangyari ang accident po na ito? So, kaninang umaga po. Okay po, ma'am. So, mga anong oras po? 8 a.m. po. Okay po. So, yan po, ma'am. Pag pinapalpate ko po ba, masakit? So, masakit po. Can you tell me po kung gaano po siya kasakit? Rate it po, ma'am, from 1 to 10. 10 is the highest po. So, 8 po. Pag ito po, ma'am, pinapalpate ko po yung sa side area, malayo po dun sa masakit, medyo lang po. Okay po. So, after that, after inspecting the area to be treated, since the patient is responsive, it means that the level of consciousness of our patient is still intact. And then, vital signs of the patients are already assessed a while ago. And then, the understanding of the patient and the procedure is already present and observed. So, sir, to clarify po, we are going to perform a cold therapy po on your left arm. Is that okay with you po, sir? Okay po. Or ma'am rather. Okay po. So, after that, we will now make sure to prepare all of the equipments that are to be used throughout the procedure. So, we will gather all of the equipments and then we will make sure to know the expected outcome of the procedure. So, the expected outcome of the procedure is to provide comfort to the patient as well as to decrease or to help the patient into acquiring comfort by removing the presence of sprain on the left hand of our patient. So, for the implementation, first is we will establish rapport. So, good day, ma'am. Again po, I am Nurse Yuri, a student nurse of this hospital, and I will be the one po who will gonna perform the cold therapy. May I know your name po? So, ayan na ako po. So, ma'am, cold therapy po will be performed to provide comfort po on your left arm. So, also po, ma'am, it will help you po to aid po yung sprain na present po dito. So, ma'am, meron po tayo ditong mga cold packs na ipuput po sa left arm nyo na makapagbibigay po sa inyo ng comfort. If you can't handle yung lamig po or yung temperature po, just tell us po para mai-adjust po natin. And if there are discomfort that is felt po, just tell us po immediately. Is that okay with you po, ma'am? Okay po. So, the expected outcome po in here is to provide comfort as well as to remove the sprain or to remove the pain here in your left arm. Is that okay po, ma'am? Okay po. And then we will perform hand hygiene. And then we will put on our gloves. So, we will put on our gloves. After putting on our gloves, we can now proceed on the procedure. However, we need to provide our patient's privacy by closing the curtains and the door so that our client will be more comfortable, and then we will drape our patient to provide extra privacy and comfort. Make sure to expose only the part that will be treated. And then now is the time for us to proceed on the steps for the cold therapy. So first is we need to make sure that we will put on a wet or disposable or waterproof cover below the patient's arm because it is the area to be treated. And now we will proceed on the application of the cold compress of the patient. So this basin acquires the appropriate temperature of the water wherein we will soak the gauze pad onto the solution with the appropriate temperature for the cold therapy. And then, we will now make sure that the water is not present on the gauze pad. So, after ensuring that, we will put the gauze pad above the area to be treated. So, make sure to snugly put the gauze pad and then assess if there are redness or irritations. Though, if there are no reaction, make sure to snugly put it on the area to be treated. And then you can reapply it if possible. So, ma'am, kaya naman po ba yung temperature po? Okay naman po ba? Okay po. So, assume that we've already performed the cold compress. We will now proceed on the application of the cold pack. So, we will put ice inside this ice bag. So, we will put ice inside and then we need to expel the air and then snugly and make sure to put the lid perfectly. And then, we need to wrap it in towel. And then, we can put it above the area to be treated. You can use tape to secure it. And then, make sure to regularly assess your patient. So, assume that we have already performed that, we can now proceed on the application of the commercial gel pack. So, this gel pack is already removed from the freezer. So, now we will cover it with towel before putting it above the patient's arm. And then we will put it above the area to be treated. So, ma'am, kaya naman po ba yung lamig? Okay po. So, now we will proceed on the application of the electrical controlled cooling device. So, assume that this is our device and then this is the wrapping area. We will first set the device. We will prepare it. We will adjust it on the temperature that we want for the cold therapy. We will make sure that all of the connections are connected and intact. So, after ensuring that, we will now put the wrap onto the patient's arm and then securely wrap it around the patient's area to be treated. And then, make sure to turn on the device and start for the cooling effect. And then, wait for the process to be done. So, ma'am, just tell me po if you experience any discomfort or any other adverse reaction po. Just tell me po so we can adjust it po. Is that okay with you po, ma'am? Okay po, thank you po. So, after performing all of the cold therapy procedures, so assume that we have already performed everything and the therapy is already done. Make sure to perform aftercare on all of the equipments that are used throughout the procedure. Make sure to put them back on their proper placement. And then, make sure to put them back on their proper placement. Remove the waterproof pad below the patient's arm and then help your patient into a position of comfort. So, ma'am, are you okay po? That's good po. Hindi naman po nahihilo, hindi naman po sumakit, wala naman pong any reactions. Wala naman po. So, after that, we will now proceed on the removing our gloves by making sure that remove it clean side out and then perform hand washing or any infection control technique. And then after that, we will proceed on the evaluation. So, we will evaluate the area that is treated. So, ma'am, I will just look the area that is already treated po. So, we will assess the skin color, the condition, and the presence of any any redness or swelling. So far, the area is in good condition. We will assess the level of pain. So, ma'am, kamusta po? May masakit pa po ba? Kumikirot pa po ba? naginhawahan po kayo sa procedure. So, that's good po, ma'am. Mabuti po yung ganon. And then, wala naman po kayong any nararamdaman. Hindi po lalong sumakit, hindi naman po sumakit ulo nyo, hindi po kayo nahirapang huminga. Hindi naman po. So, that's good po. So, as I can see, the skin or the left arm of our patient is now in good condition. Better than the condition before. So, after evaluating our patient, we will now proceed on the documentation. We will document all of the procedure that is performed, the type of procedure, the duration, the area, the duration, and the type of procedure that is performed on the patient. We will also document the patient's reaction, the patient's tolerance, the patient's ability, or the patient's neurovascular skills, as well as we will document the improvement or the expected outcome. So, we've met the expected outcome on our patient. So, the patient acquires comfort, and the presence of sprain on the area is treated due to the cold therapy. So, we will also make sure to document abnormal findings or those findings that are deviated from normal on the appropriate personnel immediately. So, that ends the application of the hot and cold therapy. Again, I am Ko Yurime M. Isidro, a student nurse of Tarlac State University.